I would like to ask for your permission to use this video for educational purpose and on internet.
Happy to do it.
Thank you. Now tell me about your life before the surgery. How was it?
I've had a lot of injuries since the mid-70s.
Okay.
Sports, mostly sports.
Mhm.
Railroad injuries, 8 knee surgeries, back, hip, hernia, a lot of which I've probably forgotten about. And nights are tough for me. I can go all day and work, and I work hard, and I like to, but nights are tough. Because
Okay,
my
so-
body, I wake up and I have to get up and I have to do this, and a lot of times I don't even remember it. I have
Yeah.
to do it.
Yeah.
And a lot of pain at night. And
So
in the morning,
how bad was your pain, 1 to 10 before the surgery?
in the mornings I usually live in about an 8 world. It's pretty bad
Mhm.
until I loosen up. I have certain exercises that I learned myself. that
How long
work for
was
me.
it going on? I mean, years? Or...
Probably the bad since 1985 maybe.
And so that's a very long time to be in pain.
I
But
played
you
a lot of
still-
sports and I
Yeah.
worked hard, a lot of
I
hard
know,
jobs.
I know. That put lots of demand. Now we went through lots of process, but we noticed the second and the third disc in your spine was what giving you most of your symptoms. And we did a surgery. That surgery, I'm going to go around here. We did that surgery just about a month ago, where we did a 2-level fusion. That surgery took us less than an hour to do, and we barely lost an ounce or an ounce and a half blood. And here are the screws. They are in perfect position. And here we go up. These are the other screws. They're all perfect. And as well, the hole where the nerves are going out, they're practically open now. But more important than how picture look like, tell us, how are you doing?
Good, and it makes sense that this is hurt because all of my lifting, especially when I roofed, I'd put 160 pounds on my
Yeah.
shoulder and go up the ladder.
Yeah.
Always on this shoulder, carry everything there.
Yeah.
Railroad, keg of spikes,
Oh
right
my.
on the shoulder, and
Yeah,
walk with
yeah.
it. So it took a lot of abuse on the right side.
Yeah. No, but how is your life since the surgery?
Oh,
How's the pain that you had before since the surgery?
The pain during the day is, I didn't know I could feel this good anymore. I had no idea.
Yeah.
I didn't know how bad I was hurting either, I don't think.
Yeah.
But it's much better. I'm uncomfortable. I'm not hurt.
Yeah.
And there's a big difference. I can tell I'm getting better, and I just can't wait till next month.
Yeah.
I just-
But there is some aggravating factor here as well in your life, right? You're
Yes.
taking care of somebody else, a loved one that is very demanding.
Yes.
But you have to do that, but obviously that's a demanding job.
It's taking a toll on me. Yes,
Yeah.
and it affects my sleep. Every
Yeah.
time she needs something from upstairs, from
Yeah,
downstairs,
yeah.
running her business,
Yeah.
my
yeah.
wife's and I'm happy to do it.
Yeah,
Don't get me
yeah,
wrong.
and that, no, but
But
you know,
it definitely takes a
but
toll. I
that
don't
is-
get much sleep.
Yeah, but it's obviously that's demanding, and that put additional stress. But my heart goes to you
Thank
that
you.
you are able to do that. But you told me that you haven't felt this good for years. Tell me
No.
about that. What do you mean by that?
Well, I sleep longer. I'm probably can sleep for 3 hours straight now at a time.
Yeah.
Very good for me.
Yeah.
And it's getting better.
Yeah.
It's been a long time since that's happened.
Mhm.
I mean, my wife has recorded me at night because I don't usually remember getting up
Yeah,
and
yeah.
hurting and
Yeah.
having bad dreams that directly relate to my
Yeah,
pain.
yeah.
Directly.
Yeah.
Reoccurring hit in the back with a crowbar dreams. Don't know where it came from.
Yeah. And we are just 1 month out. In your situation, most of my patients, actually, most of the change comes between the 4th and the 8th week. So it's going to notice significant improvement. And as you said, you're already noticing an improvement.
Oh, I know I'm on the right path here. I can
Excellent.
tell.
Well, thank you so much for this interview. I really appreciate that.
Well, thank you. You know, I went through a lot to get the surgery in the first place.
I know.
A lot of work.
Well,
And now I'm working on getting you my wife.
Yeah.
We'll talk about
yeah,
that.
we'll talk about that. But what problem did you go through to get the surgery done? Tell us.
Lots of roadblocks.
Roadblocks.
Getting Park Nicollet, how does it work? Yeah, Park Nicollet has all my records for everything from
Yeah.
ever since the 80s,
Mhm.
and they're owned by Health Partners.
Mhm.
So getting Health Partners to okay me to go out of the network, I'm sure there's some politics there. I don't know how far it goes, but I had to I literally had to tell the lady on my 7th or 8th call, I said, if you have to get God on the phone, you get him, because I need to talk to somebody that can get me that.
That's so unfair.
Yeah, it's ridiculous.
That's unfair.
It's the health system has a lot of problems, and I think
Yeah.
that's where it starts.
Now, in many cases, we hear that often, that if they have they want a lesser surgery to be done in their system, then it's something that there's a proof that works better and faster, and you approve of it.
Their
Outside
surgery
of
is
the
much
system.
more invasive. I'd be in the hospital for 3, 4, 5 days,
You wouldn't even dream
and 2
of,
surgeons.
and you wouldn't even dream of, taking care of somebody else. You would be yourself in the hospital with the old-fashioned surgery. So, but you were offered the surgery that 2 surgeons were supposed to do the surgery.
Yes.
You want to tell us about that a little?
Neurosurgeon and vascular surgeon, yes. And the vascular surgeon to move all my stomach
Cuts
and all
to the
my
side, yeah.
all my organs or whatever aside and
Mhm.
hold them there, so the doctor can open me up much worse than you ever did,
Yeah,
and do the fusion surgery.
yeah.
And I know that would have been over a year. I work hard. I wouldn't have got to work forever, and I couldn't have that.
What did they tell you how long that surgery takes, how long in the hospital? What did they explain to you about that surgery?
It was a minimum of 3 days, and they didn't know where it would go from there. It
Okay.
depends on how it goes. I mean, that's pretty major surgery.
How long did you stay in the hospital after our surgery?
I got out the next morning.
Next morning. So, and this is the record of your surgery. We did your surgery in 53 minutes, and your blood loss was 42 cc, which is 1.5 ounce, which is nothing for this kind of surgery, and we could track of all of that. So, and we didn't have to open your belly. We didn't have to, to cut your belly open and put your vascular structure at danger. That's why we didn't need a vascular surgeon for your surgery.
No, and that's not the reason I wanted you to do the surgery.
Tell me.
It's for the recovery time that I was
Yeah.
after. I don't care what you have to do to fix me, but I don't want to be able to work that long.
Well,
And I
more
knew that I wouldn't be.
Yeah, more we spend time or effort or more invasive a surgery is,
Yes.
you need more longer to recover from that. It's a easy equation that if you have to cut more, you need more time to recover from that cutting. And you're an example that I think the insurance companies, they need to rethink that.
That's how I got them to listen to me.
Yes.
I said, look, I'm going to have one less surgeon. I'm going to have less hospital stay. What part of this is a problem for you? And it was very hard to get through to them, very hard.
And your story that you are just telling us right now will help us to go to them and tell them that they should need to center their care around the patient, not around their some rules that they have put in place. Thank you so much for sharing this. Okay,
I had to tell them what OLLIF meant. I
Yeah.
had to look it up and tell them what it stood for.
Yeah,
I said,
well-
geez, where have you been?
Thank you so much. I appreciate that.